You're here. Well, thank you. My name is Cynthia Mojica. I'm associate professor in the School of Nutrition and Public Health in the College of Health. And it is my pleasure to introduce Belen Mendoza-Amezcua. Belen is a first-generation college student graduating this month, as you all know, from OSU, with a Bachelor's of Science in Bioresource Research, along with minors in chemistry and toxicology. So during her time at OSU, Belen has distinguished herself through leadership roles, mentoring both fellow college students and elementary school kids in STEM research, and also has done a lot of community engagement. So after graduation, Belen plans to work as a medical assistant while preparing for the MCAT, the Medical College Admissions Test, which some of you might know is no small feat. And she'll be applying, and I know she'll be accepted to medical school down the road. So it's been an honor to serve as her faculty mentor, and I look forward to hearing her presentation. And please welcome and joining me, Belen.
Well, good morning, everyone, and thank you all for being here. If you guys forgot, my name is Belen Mendoza-Amezcua, and I am honored to be here presenting my thesis presentation with you all. This project was completed through the BRR program, Bioresource Research Program here at Oregon State University under the direct supervision of Dr. Cynthia Mojica. Today, I will introduce the topic of HPV and HPV vaccination, as well as the factors that influence decision-making amongst college students. The methods that I conducted for my research will also be discussed, key findings, and I will end off with implications for future studies. To begin, I'll provide background information on HPV and the HPV vaccine. Then I'll discuss research objectives and hypotheses. Next, I'll review the study methods followed by my results. And finally, as mentioned previously, I will discuss limitations, implications, and end off with future directions. Before continuing, I would like to not just acknowledge my board, but you all for being here. So thank you. I wouldn't have been a presentation without the audience. So, Dr. Cynthia Mojica, thank you for, okay, this is downloaded as a PDF, so I think it's not going to do my edits, but that's okay. Dr. Cynthia Mojica, thank you so much for your guidance. It has been a true honor working with your lab. I have learned a lot, and you've been an approachable person, not only just for questions, but also for life advice in general, so thank you. Dr. Cancel Tirado, thank you so much for teaching me how to stay true to myself, even while pursuing higher education. I have gotten to know you on a personal level, and I hope to one day be someone just like you. Dr. Langelato, thank you so much for teaching me about writing effectively. As we all know, science is all about communication, and you have instilled that power in me to be able to write scientifically, so thank you. And lastly, Wanda Cronell, thank you so much for being my home away from home. Wanda hasn't only just helped me academically, but she has helped me through every step of the process. So I would also like to acknowledge my family, take the time to thank them for their support system and for always having my back. Mom and Dad, thank you for being here today. I appreciate you guys for being my #1 supporters through every step of the way, as well as for believing in me even when I lack that confidence myself. So thank you. Now that we got all sentimental, let's get started. So, to understand why the HPV vaccination decision matters, it's important to first understand what HPV is. Human papillomavirus, or HPV, is the most sexually transmitted infection in the United States. HPV is extremely common. In fact, most people that are sexually active will contract HPV at some point in their lifetime. While HPV infections resolve on their own without any symptoms, there are certain high-risk factors that can lead to serious health effects which result in cancer, some of which include oral or cervical cancer. HPV is responsible for thousands of cancers caused every year, making prevention a major public health concern. Fortunately, we have an effective vaccine that prevents the major that can prevent the majority of HPV-related vaccines. The HPV vaccine is one of the most successful cancer prevention tools available today. Researchers show that over 90% of HPV-related cancers are preventable through vaccinations. Countries with high vaccination coverages have seen drastic reductions in HPV infection and precancerous lesions. For example, Australia has experienced more than 90% reduction in vaccine-type HPV infection and is projected to virtually eliminate cervical cancer as a public health concern. In the United States, the CDC recommends routine vaccinations at ages 11 to 12 with catch-up vaccinations up to the age of 26. Despite the vaccination's proofness of effectiveness, many college students still remain unvaccinated and have not completed the vaccine series. This gap motivated the current research study. Here I present to you a timeline of the HPV vaccination. I want to show this here to show that HPV is not new. There has been research conducted with it, and it's not something that's a major finding as in like the last 5 years. So back in 1983, scientists identified HPV as a cause of cancer. By 1991, scientists identified HPV as cause of cancer. Researchers developed the first HPV vaccine. In 2006, Gardasil was approved for girls, and in 2009, approved expanded to boys. Sorry. Recommendations in vaccine coverage continue to evolve, eventually leading to Gardasil 9, which protects against additional HPV strains and cancers. These developments demonstrate how quickly scientists' discoveries were translated into preventative tools. Although vaccination rates have been improved, HPV vaccines still lag behind other adolescent vaccines. As shown here, coverages for vaccines such as the MMR and Tdap exceed 90%. In contrast, HPV vaccine completion rates remain substantially lower. The difference is important because HPV vaccination offers cancer prevention benefits that other routine vaccines do not. Understanding why some individuals choose not to vaccinate remains critical for improvement. The major point that I want you all to take from this graph is down here, circled in red, where the up-to-date vaccine is at a percentage of 63, and one dose or more is at 78%. Previous research suggests several factors influence HPV vaccine decisions. These include recommendations from healthcare providers, knowledge about HPV, perception of risk, cultural beliefs, and sexual behaviors. Among these factors, healthcare provider recommendation is often identified as one of the strongest predictors of vaccine uptake. However, less is known about these factors' influence on college students who still remain unvaccinated. This has led me to my previous or central focus of my study, which is what factors influence HPV vaccination intention amongst unvaccinated college students. More specifically, I wanted to examine whether healthcare provider recommendations, HPV-related knowledge, and sexual activity influence students' intention to receive the HPV vaccine. To address this question, I developed the following study objectives. The primary purpose of the study was to investigate factors contributing to HPV vaccination intention amongst unvaccinated college students. The objective one was to assess whether sexual activity was associated with vaccination intention. The second was to evaluate the influence of healthcare provider recommendation on the vaccination intention. And lastly, to examine whether HPV-related knowledge contributed to vaccination decision-making. Together, these objectives would help me identify factors that could improve future vaccination intentions. I proposed 3 hypotheses. The first was that healthcare provider recommendation would possibly associate with vaccination intention. The second one relating to HPV-related knowledge, where I believed that HPV-related knowledge demonstrated a positive relationship with vaccine intention. And lastly, sexual activity. Those who are sexually active will report a greater vaccination intention. So next, I will discuss how the study was conducted. This project used a secondary data from the Community Action Model Project, here now referred to as the CAMP project. This project was a college student for cancer prevention promoting the HPV vaccine. The project was conducted at Oregon State University between 2019 and 2021. The study used a quantitative cross-sectional surveys design. The survey demonstrated was guided by health belief model and theory of plan model, which I will discuss later in the presentation. Participants were recruited through a stratified random sampling based on academic level and campus locations. A total of 6,396 students were invited, 950 initiated the survey, and 669 was the final sample for the parent study. The exclusion criteria, which led from this number to that number, was taken from those who were uncertain of their vaccination studies, had no prior awareness of HPV, medical ineligible for the vaccination, or they had missing responses for important questions that we were trying to find through our project. This slide summarizes some of the demographic characteristics of the sample. The majority of participants were female and under the age of 24. Understanding these characteristics is important because they influence how broadly findings can be generalized. As mentioned, this study grounded two health behavioral theories. The first one being the health belief module, suggesting individuals take action when they perceive a health threat, believe the action is beneficial, and encounter cues that promote behavior. The theory of planned behavior processes that behavioral intention is influenced by attitudes, social norms, and perceived behavioral control. Together, these frameworks helped explain why students may or may not intend to vaccinate for the HPV vaccine. The first independent variable that we looked at was healthcare provider recommendation. On your left, my right, we have a screenshot of the actual survey and the types of questions that were asked. Participants reported whether a healthcare provider had ever recommended the HPV vaccination. And one of the questions that was asked was, has a doctor or other healthcare provider ever recommended that you get the HPV vaccine? The second variable was sexual activity, and this was categorized as either being sexually active or not. And lastly, we looked at the HPV-related knowledge. The knowledge was measured using 6 survey questions presented up on the screen, assessing the understanding of HPV transmission, the consequences, and vaccine effectiveness. Participants were categorized on having high or low knowledge. If they got 3 or more questions correct, they would be categorized as a high knowledge, and if they got less than 3 questions correct, they would be categorized as a low knowledge. Next, I'll discuss the results. So the results partially supported my hypothesis. Healthcare provider recommendation was the only statistically significant prediction of vaccine intention. Participants who received a provider recommendation were significantly more likely to intend to vaccinate. Participants who received in contrast, sexual activity was not significantly associated with vaccination intention. Similarly to HPV-related knowledge, demonstrated a positive trend but was not statistically significant in this study. These findings suggest that provider recommendation may play a more important role than knowledge or perceived risk behaviors. These findings raise an important question of how we interpret vaccination and decision-making. One of the most notable findings was that healthcare provider recommendation emerged as a strong predictor of vaccine intention. This aligns with previous research showing that provider communication serves as a powerful cue to action. Interestingly, knowledge alone was not enough to predict intention. This suggests that simply educating students about HPV may not be sufficient enough to motivate vaccination. Additionally, sexual activity did not predict intention, indicating that vaccination promotion efforts should target all students rather than just focusing on those perceived to be at higher risk. There are several limitations that I want to consider. The first was that the data collected was from a single university here at Oregon State, and even though we did consider the Bend campus as well as the Corvallis campus, this limits by making generalization. The second was that all measures rely on self-reported data, which may introduce recall or social desirability bias. And third, the sample was predominantly female, potentially limiting representation of male and gender-diverse students. These limitations should be considered when interpreting the findings. Despite the findings, the study provides important directions for future research. Future research should include more diverse populations across multiple institutes, as well as including non-binary students and other social groups. Longitudinal studies would help determine how intentions translate into actual vaccination behaviors over time. Future work should also examine structural barriers such as healthcare access, insurance coverage, and appointment availability. Additionally, research should explore what aspects of provider communication are most effective in promoting vaccination. So based on the findings that I got from my research itself, healthcare provider recommendation was the only significant predictor of HPV vaccination intention. So I believe that if we have a better focus on the type or ways that we are providing communication, it wouldn't only teach and educate others about the vaccination, but there would be a higher intent for those who are already unvaccinated or are at the age that are making decisions to get vaccinated. In conclusion, healthcare provider recommendations was the only statistically significant predictor of HPV vaccination intention amongst unvaccinated college students. Neither sexual activity or HPV-related knowledge independently predicted intention. These findings suggest that provider engagement is a stronger driver of vaccination decisions than knowledge or behavioral risk factors alone. Ultimately, improving provider-patient communication may be one of the most effective strategies for increasing HPV vaccination rates and preventing HPV-related cancers. At this time, I will be entertaining any questions. Thank you all.